Thank you, John. Welcome, everyone. My name is Rayallen Bergman, and I'm a program coordinator with SERAC. And two big projects that I'm overseeing would be the general funds grant, which is really around safe alcohol consumption for adults and promotion of that, as well as youth alcohol prevention. And you may have seen some information on the Adolescent Learning Leadership Institute, and that's going around for some of the schools, like across Eastern Connecticut. So really proud of that group as well. So just want to kind of share that information, and if you'd like to reach out at any time, we have some opportunities available with some of our funding for some projects going on. So please reach out, and my information will be at the end there. So I'm going to share my slides here. And I do want to let everyone know, I do plan to have a breakout session for breakout groups. It's about 5 minutes, around the middle of the presentation. So just look for that when you're on, when you're dropped into a group, and just a brief part of discussion and looking to get some local conditions information. Okay, can everyone see that?
Yeah, you're good.
All right, great. All right, thanks. So my email is here, but again, I'll have that up at the last slide, so you wrap up. So the safe choices and stronger communities is around our general funds, funding for the alcohol safe, uh, adult alcohol safe consumption work that we're doing. And that's a campaign. So we'll be building that out some more this year. If anyone was able to attend our statewide alcohol conference, that was great attendance, great feedback. Really glad to put that on and just connect with so many different people across the state. But we are all dealing with very similar situations here. Some of the outcomes for today's training is that want to review the changing landscape of alcohol use in recent years, as well as the chronic health issues um, related to the unsafe alcohol consumption. And we'll cover the safe alcohol consumption measures for adults, as well as alcohol prevention measures for youth that we have in place. And we'll then be rolling to the overview of mental health and wellness and co-occurring disorders and resources available. And I just want to make sure to mention that this is a non-clinical overview. That is not my background. But I would love to do a little bit of a deeper dive. If anyone is interested and has that experience, that'd be great. Please feel free to reach out. So there's a few infographics I wanted to share, which really were very alarming. And as you'll see later, we do see that in Connecticut as well. Um, but looking at this one here, this one really stood out to me because you're looking at it and it's like, all right, so 92% of people that consume, 49% are drink the or consume the alcohol. That's total, and then this 8%. So this red 8% in this um, infographic, that stands for 8% of those that consume alcohol on a regular basis. But that 8% attributes to 51% of all the alcohol consumed. That's a significant amount. Um, when we stay and look at other substances of use, you might notice that that smaller percentage has the higher rate, but this one really stands out to me. And we've been aware of alcohol and the impact that it has on our communities in many ways. But looking at this number here is like we've got a target, and we have identity. That these are national numbers here. There was an article that was a great write-up. I'm going to share this link here right into the chat. So you can bear with me as I do a stop share quick. Those that did not connect when I was pulling that up. there, and let me grab the chat. I'm gonna drop that article here. This is a nice article I thought was something that's worth looking into, and it's worth sharing with some coworkers or colleagues that might be helping to manage this situation. And then another infographic here. So this one was another very alarming one. One I was personally touched by a couple individuals I knew well, um, but there was really it seemed to be a curve happened around 2020. We know that the pandemic had many impacts on our community broadly, but one was deaths related to alcohol use. There was a changing environment for everyone. People had to adjust. Folks had a lot more time at home or downtime to themselves. Maybe some of those folks that were kind of regular consumers or were kind of what you might call high functioning, being able to manage while uh, excessively drinking at home, but still managing a job, keeping up with like everyday responsibilities and things. But we remove those from the scenario, and I think there was just so many different impacts to it. But one was the except the death rates related directly to alcohol use, which is very unfortunate. Another one here is connecting this with the chronic disease. So when we are looking at excessive drinkers, this data stood out through the CDC. So 9 out of 10 folks were not listed as dependent drinkers when they classified under excessive drinkers. So they were not experiencing a dependence on alcohol while excessively drinking. So this might be, infrequent use, maybe a weekend going out and drinking excessively, or throughout the month. But 9 out of 10 were not dependent on the alcohol, but still engaging in excessive drinking behavior. Going over the standard drinking size, which sometimes gets overlooked, I think, with the increasing um, alcohol by volume in many of like the craft drinks or independent drink distilleries. So I just want to make sure that this is mentioned again, that 12 ounces of beer at 5% of alcohol by volume is a standard drink, 8 ounces of malt liquor at 7%, 5 ounces of wine at 12%, and a 1.5 ounce of distilled spirits. So at 40% or 80 proof. This is not looking at the 120 proof or beyond. So one thing that is in the works, and they have been really trying to get this information out and make the changes to these dietary guidelines. And this is in relation to many of the chronic illnesses that have shown from either excessive drinking or moderate drinking. And those are, for women, the change was down to 1 drink or less in a day for women, and 2 drinks or less in a day for men. This is recommended, as under this would be considered for moderate drinking. And the recommendation is also to not drink due to these connections to the chronic illnesses. And additionally, do not, as we know, do not drink while pregnant. If you are under 21, still illegal, especially in Connecticut. We are still very strict on that, and many policies in place which are excellent. Much work being done around that. And also if you do have certain medical conditions, or maybe at higher risk for some particular diseases, you need to be aware of that. As you know, or if you have not heard, there is 7 different types of cancer that are related to alcohol consumption. This might be not direct relation, but there is a correlation between those diseases and the consumption of alcohol at a moderate level. And also, if you are in recovery from alcohol use disorder, it is additionally promoted to not consider drinking. So what I did want to take a look just briefly is looking at rates within Connecticut. Um, and that is one thing that we are working to build out is increasing more data coming in so that we can have a better picture of what's actually happening in Connecticut and even a tighter zoom to Eastern Connecticut. So we do have some information, but it is absolutely a gap we're working to fill better. So alcohol remains the substance of highest use and prevalence rate in Connecticut compared to all other substances. So alcohol is still the highest used substance within Connecticut. Reported past month alcohol use was most prevalent. This is for those that are age 26 and older. Um, and this is from 2022. And we're looking outside of um, that period of the pandemic and how that's worked. And as we're working back into kind of some more normalcy in our everyday life and our routines and schedules and life, and as that picks up, but it still seems to show that that is the highest prevalence rates within that age group. And additionally, heavy episodic drinking is most prevalent among 18 to 25 in Connecticut. And then nationally, that age group still stands out as the highest risk. So that is why you will see that we are working on not only youth alcohol prevention, but additionally safe consumption measures for adults. And then within Connecticut, um, this one was quite alarming. So alcohol use prevalence rate. So the rate of alcohol use in Connecticut is higher than the national, and this has been since 2010. So since 2010 till 2025, the rates in Connecticut are highest for alcohol use, and it's been among the top 10 states for all of these years. Additionally, adults age 26 or older are the highest reported prevalence rates. Sorry, and that is at 61%, above 61%. This is from Drug Free Connecticut. So that was a little glimpse of what we were looking at nationally and down into the state. So this is what I mentioned, the breakout session. Let me go back to share. So what I'm going to have us do is break out into some small groups, just about 5 minutes. I would like for you to discuss these two questions. And for us, it helps us gain a better picture of what's happening throughout Eastern Connecticut. I know there's some others that are not from Eastern Connecticut. Please do share what you see in your area because it gives us an idea on what's happening out there. So, Jen, if you want to connect, so I can break them out, or do you want to break them into groups?
Doing it right now.
Okay, all right, great. Thanks. So if you can just also pick one reporter from each group just to share back with a large group. So about 5 minute kind of break into the small groups and then we'll come back.
How many do you want per room?
Under 10 if we can. I think it might be too large if we have over that.
They should be invited now.
Okay.
I didn't set the time, so just tell me when to start closing it.
Yeah, but I've got 3 more minutes.
Okay.
One more minute, or whatever works for you to bring them back in.
It's your call. I'll give a few minutes. I'll give a 1 minute.
Heads up, yeah, in chat.
Yeah.
That works.
I want to close them.
Sounds good.
You know, when you close them, it gives them 60 seconds.
I just saw that. Yeah, have that little window too.
Yep.
Thanks, Jen.
Yeah, no problem.
All right, welcome back, everyone. All right, so I hope everyone had some great conversations. And what I would like to do is in this next section here, oh, excuse me, I'd really like to offer it up to one speaker from each group. If you could please share your discussion, just the pointers from this or any like great insights that you had. It would be, again, excellent for us as we target some of our initiatives coming up. So I'll turn it over and I'll let you unmute and you can share from your group.
I can go. So in our group, we had two people from Region 3 and one person from Region 2. So we just kind of had an acknowledgement there that we're in different parts of the state. But one of the people in our group had pointed out that with the way that social media is and how we're seeing things trending on social media, it's kind of it doesn't matter where you live in the state. The reach for the youth is happening regardless of where we live. So in that way, we're seeing some kind of similar things across regions. So we were talking about just that far reach. And then one of the individuals in our group was talking about how where she's located, she's near two kind of larger college communities, so she is seeing a lot of the Borg stuff. But again, just that like social media component to it, adding in funny names or different things that make it kind of more popular, more widespreading, more viral on the internet. Um, and then just an acknowledgement that kind of regardless of substances, just the importance of unfortunately access being just the concept of access is what came up, and then we kind of ran out of time. So that's where we got.
That's great. Thank you very much.
Thanks, Erica.
I'll go. I was in room one, and pretty much we covered everything that Danny did. So now I'm like, was she in my group? But we did talk a lot about the social norms, the concept of rite of passage, and really minimizing alcohol misuse. And pretty much it's not that big of a deal. Definitely accessibility, poor storage as far as parents, and kind of where social media has influenced kids wanting to access it more and do these challenges. We also talked about, again, like the social norms with the rural outings, the rural areas at like cookouts, and kind of how alcohol is a big piece in those types of celebrations or gatherings. Um, and ultimately how, especially for teenagers and kids, they're hiding it more, and it's a little bit more difficult to really discover it given all of the influence from like the social media aspect.
Those are excellent points. Yeah, thank you, Nicole. And I do appreciate you mentioning the rural area because living in that rural area up in the Northeast, um, I'm not too far up there, but it's different climate up here, different environment. But thank you. We had two more groups.
I can say, um, this is Karen from Wyndham Prevention Coalition. I'll just say a few things from our group. So Daniela from Carillon, she shared a few things about, she does a lot of work with data in different parts of the state too, but also that, going back to that polysubstance use, and so just but that still alcohol is such a one of the big ones for people going in for treatment, and that combined treatment with mental health and just substance use disorder kind of treatment. So and Daniela, jump in if I'm missing anything that you want to share. And so that was some of what she shared. And then what I also shared is that we've also been doing some work lately. We had another local youth group aside from our youth council that was doing a lot of work around vaping and things, and bathrooms being locked in our schools. But out of that also came discussion from youth about it's not just vapes, but sometimes students are bringing nips to schools. And so those can be, easily, you put them in your pocket. They're just, they're just as easy to hide as some of the little vaping units. So sometimes those are being found also in the trash cans and things like that as well. So just different ways that students are hiding alcohol and using alcohol in schools, aside from vapes and cannabis in their vape pens as well. And then the other thing I just spoke a little bit about too was you had asked something about tents, events where there are tents, where there are beer kind of things. And yeah, our community, we do have the Shaboo stage there. There's a lot of, town concerts and things that happen. So there definitely are times where there are going to be those beer tents. And even at Third Thursday, I was sharing last night, is that, it's a big community townwide festival, but since its inception, 25 years ago, that's been sort of a common, one of the little side spots where people kind of have to show their ID to go in, and there's music there. But there is beer availability, as well as you can now smell cannabis in a lot of different areas as well too. So, and the police are there. I mean, the police are all around everywhere. So certainly if anything does come up, they're there. But yeah, so things like beer tents are, they are a thing, you know.
Yeah, thanks, Karen. Again, more great points. And one of the initiatives was a little bit of a target towards those, um, I guess you call it like beer tents at events in town that are really bringing them in. But it's separate. But the way that it's advertised or it's promoted, um, part of the target is to try to ask them to also promote mocktails or options for folks that don't consume alcohol but still have a group of friends that would hang out in that space so they don't feel like they're pressured to drink.
Right.
And also giving them or making sure that there's like ride share information available. There's not a whole lot in the Northeast. It is smaller, maybe around like Wyndham might be a little bit better, but if you're out in like Thompson, it's going to be hard to find ride share. But finding ways to increase that capacity. But yeah, thank you. That's right along where some of our targets.
Just if I could also tack on to that too, there is a space. I'm not remembering the name of it. I think it begins with an R, but there is somebody that opened up. It's a little place that has mocktails, and it's like just a really nice little social gathering, and there are games and things like that. So
Yeah,
so it's on one of the little side streets by near one of the banks, and so that is nice, and that has been promoted around town. So that's a good thing.
yeah.
Mhm.
Oh, that's awesome.
Yeah,
Yeah, that's great. Thanks for sharing that. Definitely look into connecting.
yeah.
Well, thanks, Karen. And there was one more group, if we could have anyone that could share from that group.
So I believe that was my group two. And we just talked about kind of trends that we've seen with adolescents and, what we see in the media. So seeing in the media about when car accidents will happen related to drunk driving, whether it's, at the beginning of the school year or around prom season, and just how it seems to be kind of an annual thing. And we also talked about seeing it younger and younger. So seeing it starting like even around like kids in middle school, as opposed to maybe it used to be more so kids in high school, and kids in high school, or even older, purchasing alcohol for kids in middle school.
Hmm. Yeah, thanks, Julia. Absolutely. I mean, that age of initiation, that first first start in experimenting with the substance is lower for many of these substances. Maybe it's accessibility, or we know there's so many different factors that play into that. But that's also why, we're targeting that message to younger groups too, than traditionally. So I've been working in the field for quite a few years now. And I'm glad to see that we're really expanding some of the efforts and trying to push on those age limits or push on those populations we didn't before, and especially with the the safe alcohol consumption with adults. It's been a thing, but there's not been a real big push behind funding for projects and measures to be put in place. And just encouraged that it is expanding more and our reach is improved. And there's so many great people working on these efforts mentioned here from folks in the group and more. So yes, thank you for sharing that. Appreciate that. I don't know if anyone's been in a breakout group in quite some time, but that was great information that I can take and we can utilize. So thank you very much. So I'm just going to mention here, so looking at some of that information, those that we're pulling from this anecdotal data, is that we can turn this around into measures and effective strategies to really target some of those gaps. So as you mentioned, like middle school age. So part of our work is gearing and getting that message out to a younger crowd, instead of like that focus of that high school and kind of around just like the senior prom, and that's like a big We can put a big event and really support much around just that time, but not forgetting that, throughout the year, there's so many other opportunities to have this discussion. And there's also other age groups that may be experimenting at like middle school students. So we're trying to continue to expand and improve that reach. And also looking at we have like ID scanners, so we just did a lot of drop-offs at vendor sites and package stores um, and information out there. And we actually had quite a few of the smaller shops were very excited to get an ID scanner, so they're not just having to train their employees and making sure that they can make sure they're valid IDs for those things. So there's a lot of different movement, but again, this data gets turned back into what's the impact of our local community in each of our communities. So not just in like down by the coast, but up on the border of Mass and those towns that we have involved, and how does the picture work there, and how can we improve our efforts. There's another article here. This was shared by a colleague of mine, so it is the conversation, and I'm going to pull this link and share that also in the chat. And what I wanted to talk about is this is an easier read, so not specifically prevention and technical language, but this could be for anyone that you wanted to relay this to and be like, this is a great point. The idea around this site and the conversation that I've seen is really it'll bring up some engaging conversation around some of these topics and trending topics, and alcohol is one, and these 7 connected types of cancer related to alcohol consumption really triggered a good response on that article. So this is a good one. But I do like that it also covers trends like the dry January, sobriety, just in general sobriety, and abstaining from alcohol use. And also additional looks at some of those health measures, not just the cancer, but also those other impacts to your health. So I will share that article link as well. But it was a good one. And again, it's not so technical, but it was a good conversation starter if you want to share with anyone. So these are also associated chronic health issues related to the alcohol use. And they have found that the impacts can be to the brain, interrupting communication pathways, mood changes, behavioral changes, coordination, as we know or have seen and have heard about for quite a while. But also related to the heart, there can be rise in blood pressure. There can be cardiomyopathy, stroke relation, and arrhythmia and irregular heartbeat. That pancreas, higher rates with pancreatitis with use. For the liver is something that we've heard for so long, but really that swelling, the hepatitis of the liver, and fatty liver with cirrhosis as well, related to drinking alcohol on a regular basis. And also the immune system. That's something I think that we've learned so much more about, just from the pandemic on, and really taking care of our personal health, and diminishing that really puts us in a place of risk. So the things that we can do to take care of ourselves are important, as well as what we put in, and our intake and how that affects us. So keeping those things in mind. So this is the kind of point where I wanted to relay the type of messaging that we use, and the safe consumption alcohol measures. I like that approach. It went very well with some great conversation at our conference in the beginning of April, and it also works hand in hand with the alcohol prevention. So this is for youth, the alcohol prevention for youth. I think that this works together very well. And in light of those trends of sobriety and dry January, and putting these pieces together and really making this, showing that there's an impact nationally, but how does that impact Eastern Connecticut, and how can we improve some of that impact and some of those messaging and get that out and really work on this climate, the landscape of alcohol use. So we have the safe consumption. So this is just some some thoughts and ideas and things that are in place. So we do work on with adult safe consumption is moderation, setting limits, the seller server training, safe choices, non-alcoholic options being made available, really increasing those sober activities or those spaces where we don't feel like things are stationed around alcohol, but it can be a part, but it's not the main draw for an audience for an event. And if you're looking at alcohol use prevention, so this is something that we've been working on for a long time. But some of the points that I've been sure to discuss with our like adolescent that leadership group is ensuring they know that under 21 is still illegal for any alcohol consumption. There's a policy in place that under their parent guardian supervision, they can have like one drink of alcohol, but that is a very gray area. I think it's like a 0.01% they can have in their BAC while consuming that alcohol. So it's a very gray area. I do not really promote that part, but making sure they are aware it's illegal under 21. There's a short and long-term health and social impacts to it. Friendships can be impacted. You can have some of those additional health issues with that short-term for the youth that are using. Athletes, I try to make sure to reinforce that part as an athlete going to college and understanding that impact, those physical impacts from using alcohol and seeing that in other teammates was something that I wanted to make sure, and I reinforced that too. Refusal skills and empowerment for them to make those decisions to refuse to use. So when they're in that situation where they might be presented with it, they don't feel that peer pressure, or they may be able to make that confident decision to not drink. Or in more of a preventative way, find that friend group that's not using and set yourself up for success. And additionally, that those social norm information, like 83% of youth in Eastern Connecticut have never had alcohol before. We're looking at the larger number, so making sure that we're sharing that, what that majority is doing, not posting and reinforcing that number of like who is using and encouraging them to be part of that majority of it. And that's a long-term social norming campaign that's been very effective on college campuses and with our youth. I know we've used that for a long time, but that's some of the type of messages that we share. So I want to share on mental health, and this is another overview of the topic here. And so we're looking at it, it's looking at like your state of well-being, like every day, how are you doing when you're managing your day-to-day, you're kind of regular, you're sort of like your everyday level. Where are you at? Your mental health is a state of being which can also change though. It can be affected by many, many factors, but we want to look to make sure that an individual feels like they can manage things day to day, and we can encourage that improved well-being. So when we use a well-being, it's in relation to this. So as we know, we don't need to be a clinician to know that these are the impacts for someone that may be dealing with a mental health episode or a point where they may be feeling very stressed about a situation that they're in, or very depressed following any sort of trauma that they've experienced. But these are the impacts that can happen from someone that is within that episode, and we hope that we try to minimize the impacts here. So related poverty, bereavement, this could be the loneliness and isolation, which I know we have seen a good amount and shared a good amount, not only within Connecticut or in Eastern Connecticut, but nationally too. The numbers for defining folks that are feeling isolated or lonely are increasing. And that is a risk factor. So, there are other pieces in place that we're trying to target that, but these things can come hand in hand. But that part of addiction or at least substance use, to kind of counter some of these mental health, these points where their mental health may not be within like their normal range for them or like manageable range for them, to try to take that edge off or relax after a really stressful day. We don't promote that as, a positive outlet for that stress or relieving that anxiety. But some do, and the issue is that can lead to other problems. So just on every day looking and sharing with like folks, colleagues, friends that you know, here are some of the signs and symptoms for somebody who may be experiencing one of those periods that could be difficult for them. And this could be feeling very low over a period of time, noticing they're kind of stepping away or withdrawing or not engaging as much, maybe from that friend group. Also, you'll notice like a change in that physical appearance. I know having two kids, and sometimes like last night, it was a difficult night for sleep for one of ours, and that made that a little difficult for us. But you notice, it may not be somebody just showing up with an untucked shirt or messy hair for a day, but you know, you that appearance is going to change. And if you're noticing that over a few days, or like, it's okay to check in with them and ask, you know, how is everything going? You know, as we all know, many people are dealing with things on their own. But yeah, again, these are some of the things that stand out. So, and then social isolation, missing work or missing appointments or missing time. If you are working with clients and missing appointments, you know that could be a risk too. Um, so I just wanted to share from the American Psychological Association that anxiety is a normal reaction to stress. Mild levels of anxiety can be beneficial. Our bodies thrive from that, and that can motivate us in many ways. But dealing with that in a prolonged scenario, or dealing with that outside of something you can manage, that is in a different scenario. That is a different situation. But anxiety disorders are different from those normal feelings. So they're most common. They are the most common of mental disorders that individuals can share that they're feeling, and they do affect up to 30% of people at some point. And sometimes they're episodic. They could be short-lived for a few weeks, but you know, registering within that anxiety disorder category is above and beyond their level to manage that. So. Depression or major depressive disorder, again through APA. This is very common, and it can uh, negatively affect many people for how they feel, think, act. Nearly 3 in 10 adults, so roughly 29%, have been diagnosed with depression at some point in their lives. And again, this may be episodic, where this is a short period that they're managing it. But also with major depressive disorder, it can extend for a long period, or there could be a shift. And 18% are currently experiencing depression from a 2023 survey. So, and that's only within 2 years. And again, this is running hand in hand in that change in that loneliness and isolation. And people are still feeling that, you know, so many years outside of this pandemic and the shutdown and the change to the life. And now they're getting back into a routine, hopefully. But if they're not, they may be feeling within the space. So additionally, I did want to mention that women have been more likely than men, and younger adults are more likely than older adults to experience depression. So those two categories of women and younger adults are a little bit at higher risk for depression. And it can occur at any time, but being aware that major changes in life can also be triggers for some of these periods. So if you know someone is making a big change, graduating from college, moving into the real world, going to college, making that adjustment for changing from a job, loss of a partner, or loss of like any other current situation that they're in. So just being aware that those major changes can have that impact. Additionally, trauma. This is mental health. Within this context, it's looking at like your emotional response to this, and like either an event that they've experienced, or this could be a major shift in the things that their general everyday things. And it can be direct. It can also be indirect. It can have lasting negative effects as well. Mental, physical, social. So the biopsychosocial impact to that can be very large on any individual. But this can manifest in lots of different ways, and just being aware that an individual's kind of behavior, those things that are standing out, those changes that I mentioned earlier, like noticing that somebody may have gone through something, but they may not be able to share it as well. Trauma at times can be difficult to share with folks, so just being aware of those changes in that person and making sure that you have some connections for them, or always being that support and being available for them. Again, non-clinical, but the co-occurring disorders is looking at that engagement of the substance use right along with mental health issues they're trying to manage. And the key part is just being able to recognize this and making sure that, I can help you find that resource, or, I know someone who has this resource. We've got something valid, and let's get to it. Let's try to make sure that you have the right resources that are effective and helpful. So this diagnosis is a dual diagnosis, and so sometimes it's referred that way as dual diagnosis. And this person is going to be managing this for a period, so it's kind of like something, someone who may be experiencing episode of anxiety and prolonged, and their choice for managing that anxiety and managing that stress in life would be, I need to go, and I picked up smoking as a habit. Picked up nicotine use to help kind of manage this anxiety, and it relaxes me. Or feeling really depressed about a change in work, and kind of trying to manage that change in work and choosing to use alcohol to help manage that work, manage that change is where we're looking at like those dual diagnoses. But again, this is on like the more moderate to excessive level, and not just kind of like your everyday, maybe use or recreational use of substance. And the co-occurring disorder, so it looks like within the data that SAMHSA 2022 survey was showing that 21.5 million adults have both a mental health disorder and a substance use disorder. So an individual experiencing this is not alone. There are many others that are in treatment or have received treatment for this and help, and looking out for that person and showing that there are many things in place, because this has been a thing that we've been managing for many services for many years now. So don't be afraid to reach out. There was some of the findings from this co-occurring disorders report from SAMHSA was that many of the common mental disorders that were mentioned was like anxiety, mood disorders, schizophrenia, bipolar, major depressive disorder, conduct disorders, post-traumatic stress disorder, and attention deficit hyperactivity disorder. But in relation to individuals sharing that they had a diagnosis or qualifying for that, there was also the secondaries like substance use, polysubstance use under alcohol, tobacco, opioids, stimulants, marijuana, hallucinogens, and prescription drugs. So I have a video here, and I do want to share this. It's a nice breakdown, and it was from an agency. I'll stop before they go into their marketing part of it. But it's about 6 minutes, and it shares some like a great overview, a little bit more into the clinical side of it, but a great overview of co-occurring disorders and dual diagnoses. And I'm going to open and get that started right now. Again, if I did want to take a second, if you had any questions, please feel free to drop it in the chat, or you can reach out anytime afterwards. But I hope to connect if you have any questions at a time. Okay, if you can hold on, I'm going to start this up.
What in the world is a co-occurring diagnosis, aka a dual diagnosis? Well, according to the Substance Abuse and Mental Health Services Administration, the coexistence of both a mental health and substance use disorder is referred to as a co-occurring disorder. If that definition only causes even more confusion, no worries. In this video, I'm going to be talking about why mental illnesses and substance use tend to happen together, even go into some common mental health conditions, so that way you know you're not alone in facing some of these symptoms, and share some healthy, actionable steps that you or someone else that you know can take right now that'll help you begin improving right away. My name is Emmanuel with Sandstone Care, and here we provide substance abuse, addiction, and mental health treatment. More about who we are and what we do at the end. Let's get into the video. Why at most times do mental illnesses and substance use tend to go hand in hand? The best place to start is to think about how people cope when a negative challenge or new mental obstacle comes up. When a negative or challenging situation comes up, do you, your friend, or your loved one respond by coping with exercise, or maybe processing your emotions through art, music, crafting, talking to others about how you feel, or spending time with friends and family? If so, these would be some healthy coping methods and positive ways to deal with mental and emotional challenges. But on the other hand, in terms of co-occurring disorders and dual diagnosis, when a similar challenge comes up, that person would choose to self-medicate and feel better with the use of a substance of some sort. This could be substances like marijuana, alcohol, stimulants, uppers, and more. The thing about coping this way, though, is that by using a substance, the need to use that substance to feel better over time increases. This normally only temporarily solves the problem, or progressively makes things worse. Substances don't help to build positive, healthy coping mechanisms nearly as much as exercise, journaling, and other positive mechanisms I mentioned earlier do. So when it comes to knowing what a dual diagnosis or what a co-occurring disorder is, understand that there is a connection between coping with negative and challenging situations with the use or abuse of a substance, as I just mentioned a moment ago, and mental illnesses. Now that you understand a dual diagnosis is a connection between substance use and someone's mental condition, in this next section of the video, I'm going to be breaking down 5 of the most common mental disorders that normally co-occur with the dual diagnosis. The first I'll be talking about is ADHD, or Attention Deficit Hyperactive Disorder. ADHD is a mental condition where the person affected struggles with the ability to sit still. You might find it difficult to keep attention, or you become easily distracted. Some other symptoms also include being impulsive or hyperactive. So this means you are feeling this constant sense of restlessness, or feel like you're becoming more quickly bored with anything. Common substances that co-occur with ADHD are stimulants. These stimulants normally contribute to anxiety, and people with this disorder typically use these stimulants to either support their own focus or self-medicate. And just a quick reminder before moving on to these other mental conditions, self-medicating again does not typically solve the root of the problem. It only temporarily fixes it without providing a long-term solution. The next mental condition I'm going to talk about is depression. Some of the symptoms of depression include feeling sad, irritable, having this constant feeling of emptiness or numbness, or even losing the feeling of excitement or pleasure during activities. Sometimes depression can be situational, like if you lost a close loved one or someone that you're close to, or if you're going through a huge transition in your life. And other times, family genetics can actually play a role in how much you're being affected by depression. In terms of depression and substances that are normally used, things like alcohol, marijuana, and stimulants like coffee or even cocaine are typically used. Next, anxiety disorders. Under this category, I'm more specifically talking about panic attacks, obsessive compulsive disorder, social anxiety, and phobias. These anxiety disorders can be characterized by having this constant excessive worry and anxiousness. This means that because you're constantly feeling this sense of worry, you struggle and have a difficult time relaxing and settling down. The substances that normally co-occur with anxiety disorders are depressants. Some examples of these depressants are things such as alcohol, marijuana, and prescription drugs. Next up, bipolar disorders. Bipolar disorders, which previously was actually referred to as manic depressive disorder, is characterized by large swings between depression and mania. So with this mental disorder, you're experiencing the symptoms from the lows of depression, as well as having certain periods where you're actually feeling like you have a super high amount of energy, lots of excitement, or even a sense of feeling of euphoria for an extended amount of time. When it comes to understanding the substances that normally co-occur with bipolar disorder, it is more difficult to say what substances are used because you're experiencing both emotional lows and highs. Either way, the substances that are used to self-medicate and try to help typically heighten or increase the symptoms, which again does not provide that long-term solution. Instead, it only prolongs or temporarily fixes the problem. Last but not least of the mental conditions I'm going to talk about is personality disorder. Under this category, I'm more specifically talking about narcissistic personality disorder, borderline personality disorder, and antisocial personality disorder. Many people with these disorders have an internal thought or behavior pattern that keeps them from relating to others. People diagnosed with this often lack a coherent sense of self, which makes it more difficult for the individual to understand and respond to others emotionally, or even relate to other people's experiences altogether. Substances that normally co-occur with personality disorders are things that soothe and numb the feelings. This could be things like alcohol and prescription drugs. It's important to note that these mental disorders, along with the combination of substance abuse, if this goes left unchecked or unresolved, the person that's self-medicating may never learn or gain the ability of knowing how to healthily cope during times of mental and emotional stress. If you are struggling yourself with any of the symptoms that I mentioned in this video, or if you want to talk to a real person and dive deeper into understanding dual diagnosis, but don't know where to go, no worries, that is why Sandstone Care is here to help. Here, you can contact
Thank you. I'm going to come back from this part of the video. If you can hold on with me 1 second and make sure I do not lose it.
that we offer here.
Sorry. 1 second. Stop sharing. Move past that. Okay. So I do want to relay. So I actually found this nice little breakdown of through DEMIS and those supportive services that they're available within the state. You know, I hope everyone knows if anyone is experiencing any difficulty or managing um, any crises or looking for resources, services, help, assistance throughout Eastern Connecticut, that 211 is the best updated outreach for available services for their area. It can help them pinpoint what is available within their community. But also looking at, here are some, if you will look and follow up with, COSIG is an interagency group. There is the Integrated Dual Diagnosis Treatment, the ACT. There are teams that are put together for this. There's also jail diversionary activity programs that are in place. There are additional co-occurring programs that can be found on Psychology Today. If you were to look at, if anyone was looking to find a treatment provider, they can be found there. And again, just making sure that are well aware of the Connecticut, the outpatient types of programs through various services and some great partnerships that we have in place. But those can be found through 201. It's probably the easiest route, but they are available. There are many opportunities out there to help any individual looking for more support and services. So please feel free to reach out. Was unable to check in the chat. Is there anything that we missed as I go into our next one for our evaluation? I just wanted to make sure and address that if there was any there. Or if anyone would like to ask any quick questions or share any input, that would be great.
You do have a question in the chat, Rayallen. So you have
Sure.
what about medical/physical health issues, the comorbid challenges people may be dealing with, and dealing with tri-occurring/morbid issues, whether issues are all diagnosed or not?
That's a good question. I